Uterine fibroids are benign masses of the uterus that form in many women. They start very small and respond to the estrogen that's circulating in a woman's body and can get very large.
Some of the problems can be very heavy vaginal bleeding. Some of the problems can be pressure in the lower abdomen and the pelvic area. It can cause abdominal bloatedness and the feeling like you're pregnant or you're gaining weight where your clothes fit tighter. Difficulty with urinating, feeling like you have to urinate all the time.
I was 42 when I found out I had uterine fibroids. I had very heavy bleeding. I had very painful periods, and I also had breakthrough bleeding throughout the month.
I was 42 years old when I was diagnosed with fibroids. I was unable to fit into my clothes, especially my slacks, well, over my abdomen area. That's where, the fibroids sat. It was very uncomfortable.
Much of the symptoms depend on the location of the fibroid. Fibroids that are inside the wall of the uterus tend to cause more bleeding. Those that are on the outside cause more bulk symptoms or feeling like there's a mass in the abdomen.
A patient's quality of life is severely, severely affected by uterine fibroids. If she has very heavy periods due to fibroids, she's missing work, she's not productive, not to mention the fact that she may actually also be living with daily pain and trying to manage that and a busy life.
I did have to limit my activity the first 2 days of my cycle because of how uncomfortable I was. The doctor at the time wanted me to do a partial hysterectomy, and that's the reason why I tried to do some more natural remedies for this, but nothing had worked.